Radial nerve palsy is associated with humeral shaft fractures. Is the most common nerve lesion complicating fractures of long bones. The overall rate of this complication is between 8 and 17%. Some fracture types like transverse and spiral and particular location of the fractures in the middle and distal third of the humeral shaft are more likely to be associated with this type of complication. This is also valid for high energy and open fractures. Nowadays, there are still considerable differences in the opinion regarding the choice of treatment, one of the main being the early exploration of the nerve. When to be done, in what kind of fractures or in what kind of deficit, and the other main question is, should it be done routinely or should we have an initial management of expectancy? The aim of our presentation is to show the results achieved after treatment of humeral shaft fractures with injury of the radial nerve. For a period of 8 years, 225 fractures were treated, 39 of which with primary radial nerve palsy and 4 with secondary. The complication was distributed between 20 women and 23 men. There were 33 high energy and 17 open fractures. 14 patients were with polytrauma, 4 with floating elbow and 4 with ipsilateral fractures. According to the mechanism of the trauma, in 25 cases it was a motor vehicle accident, in 10 it was a fall from a high, and in 5 gunshot injury, and only in 3 cases it was low energy fracture. The classification was done according to the AO classification with prevalence of type B fracture, and according to the anatomical location of the fracture, it was the highest percent located in the middle and distal third of the humeral shaft. Intraoperative revision of the nerve was performed in 19 cases. In 13 there was only contusion of the nerve. In 3 the nerve was found entrapped in the bone fragments, and in 3 cases again there was full nerve transection. Delayed exploration 3 to 6 months after the injury was performed in 6 cases with 2 neurolysis and 2 neurorefies. Late exploration 6 to 18 months after the injury was performed in 4 cases, again with 2 neurolysis and 2 graft procedures from the suralis. The results achieved, there was spontaneous recovery in 93% of the patients treated non-operatively. Full recovery following intraoperative revision was observed in 79%. In 67% of the group with the delayed revision there was full recovery, and for the group with late exploration there was full recovery in 2 patients. No recovery was observed in 4 patients. So we come to the critical question to operate or not in this particular case, to treat the radial nerve palsy conservatively or surgically. According to one meta-analysis of 35 articles with 1,045 humeral shaft fractures complicated with radial nerve palsy, there was full recovery in 88% and spontaneous recovery in 70.7%. David Trunk, in one of his articles, reports for 24 high-energy fractures with 14 nerve revision. Nerve was found fully transected in all 6 complex open fractures of the extremity, which is approximately 25% of all fractures in the series. There is no significant difference, again according to this meta-analysis, which is probably the largest one in the literature, in the extent of recovery rate between the groups initially managed expectantly and those explored early, but the overall waiting time should not be longer than 6 months. In conclusion, I can say that even though our series does not contain enough number of patients to draw a definite decision indicated for early revisions, are open fractures, high energy fractures of the middle and distal third, humeral shaft fractures with ipsilateral fractures of the extremity. In other type of fractures, initial expectancy must be considered up to the fourth month. Thank you for your attention.